Hi, my name is Haley. Today my mom is bringing me in for surgery at St. Mary's Children's Hospital. You can follow along, so if you ever need surgery, you'll know exactly what to expect. My mom says we're right on time. The first thing we're going to do is check in on the third floor. This is where I'll get a plastic bracelet with my name and birthday on it, so everyone knows who I am. Today, I'm kind of a big deal. Next, we take a ride on the elevator to the 8th floor and let the nurses know we're here. Now, we're heading to the coolest room in the entire hospital. This room, and on surgery day, it's my room.
Haley, are you ready?
Look at me, Mom!
You look great.
Before we get started, I get to change into these cool hospital pajamas. Today, mine have tigers on them. In my room, a nurse will check my vitals. That's fancy hospital talk for making sure I'm ready for surgery. She checks my weight, height, and temperature. She also checks my blood pressure with a machine that gives my arm a little squeeze. In my room, I get to meet a lot of new people. This nurse asks me and my mom important questions. She makes sure I have not eaten or had anything to drink this morning. She puts all of our answers into the computer. Next, I meet a child life specialist. She tells us all about what's going to happen today. She answers our questions, shows me pictures, and lets me touch some of the medical equipment. This stuff is really cool. This is like the mask I'll wear in surgery to help me fall asleep. She even lets me pick out a yummy smelling lip balm that we rub inside the mask to help the mask smell better. Sometimes you have to wait a little bit to go into surgery. Luckily, there are lots of fun things to do while you wait. You can color, watch TV, or go into the playroom. When it's time for surgery, a nurse comes to get me and my mom. She gives me a ride on this cool bed with wheels all the way down to surgery. Like I said before, today I'm a pretty big deal. In the pre-op room, I get to meet with my doctor. She makes sure my mom and I don't have any questions before surgery. Next, I meet the nurses that will help me with my surgery. One nurse will stay right by my side the whole time during surgery. Now, we meet the anesthesia care team. These are the people that will give me sleepy medicine. They'll use a stethoscope to listen to my heart and have me open my mouth real wide to make sure I'm looking good for surgery. I'm not really tired right now, but they talk to me about a special mask that will help me fall asleep when it's time for surgery. Then I show them which lip balm I picked out to put on the mask. If I was a little older, the doctors might want me to get the sleepy medicine through an IV. An IV is a poke that leaves a tiny straw in my vein. It kind of feels like a pinch when it goes in. I was nervous about going into surgery alone, so I asked my doctor and my anesthesiologist if my mom could come into the operating room with me. They said yes, but first,
Ta-da! Do you like it?
she had to put on a bunny suit so she doesn't bring germs into surgery. Mom looks funny. I wish I could take a picture. You can ask your doctor and anesthesiologist if your mom or dad can come back into surgery with you too. When it's time for surgery, my surgery team gives me a ride into the operating room. Everyone's wearing hospital clothes, hats, and masks to make sure everything stays clean. It makes me feel better knowing my nurse will be right by my side during surgery. My surgery team puts stickers on my chest and belly so they can watch my heartbeat while I sleep. They also put a sticker on my finger that tells the doctors how well I'm breathing. Then they put a blood pressure cuff on my arm. It gives my arm a little squeeze when it starts working. The anesthesiologist shows me one more time how the sleepy medicine works with the mask. And once I'm ready, they put the mask on me and I start to get very sleepy. And just like that, surgery is over, and I wake up in the recovery room. There are a lot of computers in the room, and even other people who just had surgery. I still have the stickers on, and I will still have an IV in my arm. Remember, this is a small straw to help give you medicine. If you're not feeling good after surgery, it's okay to tell the nurse. She might be able to give you something to help make you feel better. After just a little bit of time in the recovery room, my nurse gives me a ride on my bed back to my room where my mom is waiting for me. Then I can have some juice or even a popsicle if I want. Some kids have to spend the night after surgery, but my nurse says I get to go home today. When it's time to leave, the nurse gives me a ride in a wheelchair to my car. Well, that's it. That's all there is to having surgery at St. Mary's Children's Hospital. Thanks for coming with me today. Bye!